I've just completed a face-to-face encounter on a 36-year-old female with a history of diabetes mellitus type 2, hypertension, hyperlipidemia, and pancreatic cancer. Interestingly, her pancreatic cancer was diagnosed as a T3N1M1 pancreatic neuroendocrine tumor involving the body of her pancreas and metastases to her liver. She did undergo a splenectomy and a distal pancreatectomy at that time and followed up with her medical oncologist, who did a thorough workup for multiple endocrine neoplasia syndrome, which he did rule out. Unfortunately, she did not follow up with him consistently, and in February of 2024 presented to the emergency room with abdominal pain, nausea, and vomiting, and underwent a CT scan that revealed multiple heterogeneous masses in her liver lobes and retroperitoneum. She opted for no surgical intervention, but she did opt for systemic chemotherapy through her life port, which was implanted in March of 2024, and her chemotherapy was started in March of 24. She reports that last week during her chemotherapy session, her glucose was elevated, and her oncologist covered her with insulin, but recommended that she follow up with her PCP for her diabetic management. She reports that she is here for that follow-up diabetic management, and reports that her blood glucoses have been running in the 200 to 400 range at home, and she does endorse polydipsia, polyuria, polyphagia, fatigue, but denies headache or further abdominal pain, nausea, or vomiting. She does state that she takes metformin 500 milligrams twice daily with a meal and is able to tolerate it, but cannot tolerate the 1,000 milligram dosage due to nausea and diarrhea. She reports that in September of 2023, which was her last clinic visit here, she was prescribed Ozempic for her diabetes, but never picked up that prescription and started it. She reports that she's noticed some swelling in her lower extremities and believes that it is occurring from working at a desk all day. And she reports that she takes losartan 25 milligrams once a day, hydrochlorothiazide 12.5 milligrams once daily, along with the aspirin 81 milligrams low dose once daily for her hypertension. Upon review of her point of care lab work, her A1C is 10.2, down from her labs I reviewed from June of 2024, which her A1C was 12.1, and her blood glucose randomly on point of care today is 290. Her blood pressure is 125/73, well controlled on her losartan and hydrochlorothiazide, so we will continue that therapy for her hypertension. Upon exam, she is hemodynamically stable. She has clear lungs to auscultation. Her heart rate's regular, rate and rhythm. There is no pedal edema. Her dorsalis pedis pulse is 2+, and her cap refill is 2 seconds. On abdominal exam, she has no involuntary guarding, no organomegaly, no tenderness. For her continued therapy, I would like to discontinue the order for her Ozempic due to its effects on the pancreas and contraindication in pancreatitis, and with her sick, ill pancreas, the benefits, risks do not outweigh the benefit. So I'd like to start her on a basal insulin. The Lantus Solo Star would be effective, I believe, for her at 10 units in the evening daily, and for her to continue her fingerstick blood sugars 3 times a day, with 1 being fasting, and to bring those to her next appointment. As stated earlier, we'll continue her on her losartan and hydrochlorothiazide and aspirin therapy. and have her back in 4 to 6 weeks, and she'll continue to follow up with her oncologist.